What, if you know, what is Dr. Tiller's training as it relates to psychiatry and psychology?
I don't know the backgrounds of Dr. Tiller adequately to comment about it. He's a medical doctor. He's had a full medical education. As I understood it, he worked in pathology for a while. I also understood that he was not a psychiatrist, and but that's as far as I go. I've not met him, and I've not talked with him about it. And again, I wasn't asked to speak about his qualifications. I was asked to speak about what these records show that would give a sense of the patient, and also, in a sense, show the adequacy with which they were being approached psychiatrically. That's why I'm here. I'm here to speak to what constitutes adequate psychiatric attention and adequate psychiatric evaluation.
Let me ask you this. As you read through these files and these records, did you see evidence that a second doctor confirmed Tiller's opinion that the women would suffer severe and irreversible damage to a major bodily function?
Yes, of course. I mean, the law requires, other than in Kansas, that two doctors do look at them. And there was a second doctor, and there was always a letter from the second doctor that would say that, in her opinion as well, these women suffered, could potentially suffer from irreversible and substantial impairment of a bodily function. This is mental bodily, a bodily function construed in mental terms if they didn't receive an abortion. But again, that letter did not come with the kind of pages of psychiatric study, evaluation, biographical details, and understanding of the person on which, from that record, you can confirm that opinion.
How would you describe that second opinion?
Well, at least from the record, that second opinion rested upon a description of the, rested upon an encounter with the young woman and a statement of her present state of mind. So it was an opinion derived in much the same way from the statements of the patient themselves about how distressed they were.
Would you describe it as highly detailed?
No, I wouldn't describe it as highly detailed. I would describe it as brief, symptom-only based, and unsubstantiated in its prognosis on the basis of a rich, detailed study of the young woman and her potentials. Okay? If you're going to take a life on the basis of a psychiatric examination, in my opinion, and I think the opinion of most psychiatrists would be, this requires a serious understanding of the full biography of the person, as well as the place that they are at the moment, the context in which this has happened, and what are the resources, which are quite, after all, in our country, the resources for psychiatric services and psychological services are rich. And well, one wonders, looking at this, why some consideration isn't being made to employ them for the benefit of these patients. And so the conclusion that imposes itself upon, I can't say it's a conclusion that necessary. The conclusion is these young women came here for an abortion, and the effort on the part of the psychiatric assessment was to support that idea that an abortion is appropriate, rather than considering the alternatives, the risks and benefits of this to the person in a life. Nothing like a person in a trajectory in a country that now is prepared to help its mothers, I believe, and a country that's so starving for adoptions that we go into deepest, darkest China to bring these dear children out. I mean, that's what a psychiatrist draws from seeing these records. Now, as I said, I never met the patients. I don't know their names. I never met the doctors. But that's not what I was asked to do. I was asked to talk about these records as evidence for the appropriateness of abortion to prevent a substantial and irreversible impairment of the minds of these young women.
And did you see anyone file that justified a late-term abortion by demonstrating that she would suffer substantial and irreversible harm?
I saw no file that justified abortion on that basis. All the files justified the abortions on the patient's present state of mind of being distressed and social proposals that this person's life would be less successful, less developed, less opportune if this child were born. And those are not psychiatric reasons, those are social reasons.
Dr. Mchugh, when did Attorney General Phil Kline hire you?
He hired me in late 2006, and I was doing the review of these records in December of 2006.
And based on these records that you reviewed, would you be comfortable making any sort of diagnosis?
On the basis of these records, I wouldn't be satisfied with any specific diagnosis. And in point of fact, a diagnosis probably doesn't capture the issues before you in these women. A diagnosis is a pigeonhole. To really understand these women, I believe that you would draw up a full history of them and formulate them as people in distress and trouble. And so my diagnosis, if pinned to the wall on that, would not be a simple psychiatric diagnosis. It would be that these are demoralized people, discouraged, depressed in the sense of being discouraged and disheartened, those kinds of feelings. And I would identify them as that kind of person, okay? Rather than subject them to a psychiatric diagnosis like major depression or acute stress disorder, because it wouldn't carry the meaning of what was there. But these records that I had are so inadequate that I couldn't confidently support either the diagnoses given or these ideas that are impressions that come across from the few descriptions of the women there.
Do you believe anyone else practicing psychiatry would be comfortable making a diagnosis based on what you saw?
Well, it's always difficult to say what another doctor would say comfortably. I think that a psychiatrist would say that these would all agree that these are inadequate records for laying out a psychiatric diagnosis and a psychiatric plan. And it's a psychiatric plan that is needed here, and a psychiatric plan that is being proposed as solved by an abortion. That's what is intended in these files, and they're inadequate.
Is anxiety disorder permanent and irreversible?
No, anxiety disorder, of course, is not a permanent and irreversible condition. Psychiatrists treat them all the time. And in this situation, the anxiety is related to the pregnancy and could be dealt with in the way we deal with the anxiety of pregnant women all the time.
What about adjustment disorder? Is that permanent and irreversible?
By its very name, adjustment disorder, it means that the person is having difficulty adjusting to this situation and needs help in adjusting. So by the words themselves, they carry the meaning that this is not permanent and irreversible.
What about single episodic severe depression? Would that be classified as permanent and irreversible?
No, one doesn't classify that as permanent and irreversible. In fact, it's a treatable condition. And once again, remember, these diagnoses are not coming out of off the wall. They are being applied to individuals whose context we understand. These are individuals troubled because they're pregnant, and the attachment of this diagnosis to them doesn't inform you very much about either the situation, and it certainly is not a diagnosis that carries with it the same implications as the disease that will be permanent and irreversible would.